Welcome back to Shoot Me Straight with Eddie and Dave. Today we have an awesome guest, Dr.
Dockendorf?
Dockendorf.
Yes,
a.k.a. Dr. D for short.
Drip.
Yes, or Dr. Drip.
Dr. Drip.
Yes.
That's your crip name.
Yes, that's my crip name. My moniker.
Yeah. We met, so I went to Aqua Vitae, which is the...
Vitae.
Aqua Vitae.
Yes.
My bad, dude.
That's all right.
Aqua Vitae.
Everybody does it.
Yeah.
I'm wearing Aqua Vitae cologne.
Maybe that's why I did it, yeah. Aqua Vitae, I went down, it was a while ago now, to get some IVs from you guys, and you guys run an awesome program down there.
Thank you.
It's an awesome shop. I like the whole vibe. It's really cool, and ever since I started going there, because I travel a lot, and you get worn down when you travel and everything, so between trips I go there, and I literally haven't been, sick in a long time, except for right now I'm catching something. But I think it's more like the pollen season around here, the allergies. But yeah, dude, I wanted to get you on here, to talk about yourself and just how you got to this point, how you started that IV drip bar, but then also talk about the benefits and everything you guys offer.
Sure.
Because I know I've been getting the NAD from you guys, and I've had great experiences with it. But there's also, I talk to other people, and there's different trains of thought of whether it works, whether it's snake oil.
Right. So
I definitely want to hear it from you, what those things can do for you, and then talk about what all the other things that you offer as well.
Wonderful, absolutely.
Yeah.
First, I want to say thank you for inviting me. I have nothing but respect for you, and for you to invite me on here, that means a lot. And this is a great forum. I'm glad that you have this to offer. So I think this is great. A lot of people do have that concern. Is this snake oil versus does this actually work? One thing about me, my background is I am a board-certified emergency medicine doc. Most board-certified emergency medicine docs are very transparent and very skeptical. We practice evidence-based medicine. Mm-hmm. So it took a while. I do still practice in the ER out at Fort Walton Main Hospital. And when I decided to switch over to, if you want to call this alternative medicine or preventative medicine, if you will, it took a while for me to even get to the point of where I would want to carry NAD because I have a lot of people that come in and they tell me, hey, you should try this, you should try that. And I say, why? Well, my Uncle Tommy tried it. It worked so well for him. And that means nothing to me because I call that anecdotal evidence. Yeah. So after about a year of hearing about NAD, I finally said, wow, there's a lot of people that want this. Maybe I should research this. So I did. And I found a very, very respected peer-reviewed journal that a good journal or a good article or a good research article is one that tries to disprove, right? That's what every research article should do. That's the whole point. They try to disprove something from working. Well, this article was very impressive. It's a double-blind, one of the studies that take out all the outside factors of drug reps or whatever. And what it was they did it in rats, and rats are fantastic to study because their life cycle is so short, 6 months to about a year, and you can gain a lot of information over the life cycle of that rat because basically one rat year equals 80 human years, essentially, right? So what they did was they took thousands of rats in one group, the placebo group, and 1,000 rats in the non-placebo group, and they injected the rats that got it, got the NAD, and with their parameters, this was so interesting. The rats that got the NAD lived 25% longer and had 50% more energy than the rats that didn't. And the conclusion of the paper was, there's something here. And that caught my eye. So I said, okay, I'll give this a shot. I'm going to try it. I'm part of the pun. So I ordered it, and I called the pharmacist because when it came in the vial, it said IV or IM, intramuscular. And I asked the pharmacist, well, how should I do this? I want to try it on myself to see if this works. Because I never, ever give anything at my IV bar that I haven't tried on myself because I want to see if it works as well. Because you already know, Eddie, I'm pretty high strung, and I have ADHD, which is probably why I went into emergency medicine.
You're in good company.
Yeah, and I tried it, and he said, the pharmacist he's like, man, you never tried it? Oh, you are going to be in for a treat. So I said, all right, how much would you recommend? He said, inject 200, which is the max dose for an injection. I injected myself, and within 60 seconds, I felt just an overwhelming, I almost call it a Zen-like buzz, but then all of a sudden I just felt this great energy. And not from like a stimulant, like amphetamines or some of the bad stuff that people take out there to give themselves energy. It was just a sense of calm and a sense of focus, and it changed my life. I said, oh my, there is really something to this. This is the only thing that I have at the IV bar where you get it, and you've known this through experience, where you feel it as you're getting it. Oh,
right away, yeah.
Right? And that carries on into the day. And so I said, all right, man, this is wonderful. I was a little over high strung after I got it, but not dangerously high strung, right? People who use illicit drugs, it's dangerous, right? If you take too much of something, you could get a heart attack. This stuff is about as safe as you can get, because what is it doing? It is, and it all makes sense. NAD is the precursor to ATP, and ATP is the voltage requirement, right, for every cell in your body. When you turn 50, your NAD levels, just like testosterone, tend to go about down to 50%. Mm-hmm. So your cells don't function as well as they used to. What does that lead to? Fatigue, disease. As a matter of fact, NAD also is very important in DNA replication errors. So that's another big thing. So that's when they touted it the fountain of youth, because when you get it, if you get it on a regular basis, people tend to feel about 10 years younger than they did before. And that comes on immediately. And for some people, I would say, I've done over hundreds of people, but there are some people who, when they immediately feel that difference, some people do get a feeling of sense of doom, and that's people who already have anxiety. I liken it, and I make a joke about it, to those that take a marijuana brownie.
Yeah.
And they're like, I don't feel anything. So then they take another one, and then all of a sudden it kicks in, and they think they're dying. We see those people in the ER all the time, and then we laugh at them. But NAD, I'm very good at vetting who I'm giving it to. I make sure you don't have a psych history, and I warn them you are going to feel differently. But what it's doing is it's powering up the good cells, and you feel better than you ever have. So it's being studied in everything. Not only just fatigue, but it's being studied in MS, dementia, Parkinson's, because they're finding that there are a decreased rate in flare-ups for MS. It's slowing the rate of Parkinson's or dementia, and that's exciting. That's really exciting. And I have people who have end-stage MS who can barely walk, who come in and get it, and after they get their injection or their infusion, you got to watch them, man. I was first worried, is this going to be one of those, you've been healed, and there's the power of the mind where it makes you see it on church where the person drops their wheelchair and they can walk, extra 10 feet, pure placebo. This works, and it's starting to be recognized across the medical community as, hey, this is something here. And so that's why you see places like Mayo and other big research centers who are saying, hey, there's something here, let's research it. And then once it becomes more mainstream with those people, well, then watch out, because they're probably trying to capitalize on its benefits.
Or replicate it in some form or fashion. Yeah.
And then put a name to it, other than NAD.
What would it be classified as? Is it a peptide?
So it's an enzyme. I would classify it as an enzyme. It's I wouldn't call it a peptide. Peptides are really more of an analog to like a protein of some sort, or a messenger. So like even the weight loss, tirzepatide, semaglutide, Samorelin, all those are peptides. This is in its own kind of category. So it is just an enzyme that is a. Are you familiar with the Krebs acid cycle? Do you remember this thing in biology?
You got to refresh my mind.
It's okay. It's so in biochemistry there's a cycle called the Krebs acid cycle or the citric acid cycle, and what it is that is the cycle of how ATP is made. So NAD is the most important precursor to making ATP. Every time that cycle goes through, you get 32 ATP. Okay, that 32 ATP, the ATP is then, which stands for adenosine trinucleotide phosphatase. And what it's doing is it's donating electrons to the ATP to make that ATP. So if you don't have enough NAD, you don't have enough ATP, your cell doesn't function as properly. It completely makes sense. And then once you try it, you feel what we're talking about. All it's doing is making the good cells power up efficiently.
Well, I can say, like, so when I started doing it, I think I do 250 IV
Yes.
with glutathione usually.
Yeah.
I put it in there, but I can feel it pretty much, like you said, well, when I'm getting it,
Yeah.
and then, if you have it full bore, and I think twice now when I've been getting it, and it depends on the day, I'm like, yeah, full bore, I'm fine, but then sometimes I'm like, oh, I'm like, I'll start sweating and like I feel like a burning sensation in my stomach a little bit. But you turn it down and it's like it goes away. But when I leave, usually 5 minutes later, if I'm driving back, my cognitive state accelerates.
Absolutely.
I start thinking clearer, and then I also notice for like the next week or two, when I work out or do any kind of movements physically, I can feel it in every like muscle. Like I can feel every muscle activating, where before, if I didn't have that, it's hard to like get certain muscles to activate, and like so that it prevents injury, I believe, because then you're able to use your body functionally.
Yeah. Have you noticed that you sleep better too when you had it? Have you noticed that?
Yeah, probably.
Yeah. And you're doing a lower dose. 250 is on the lower end. 50 milligrams is the lowest you can go. That's for a shot. For injections, it's 50 to 200 milligram. That's the max that you can give. And there's a reason the max you can do is 200 is because, as you know, you do feel differently. And if I give you more and it's going intramuscular, if you don't like the way it's making you feel, I can't shut that off. With a drip, we can titrate when you go, hey, this is, can we slow it down a little bit?
Yeah.
After I slow it down, those the bad side effects. And by bad side effects, we're talking, like you said, maybe some nausea.
Uncomfortableness.
Right. Those go away real quick. So when we're giving you a drip, it tends to be, we're from 250 to up to 1,000. We do have a gentleman that does 1,000.
I remember you told me that.
Yeah, he's crazy, and he's a good friend of mine, but that's superhuman. And he comes in weekly to get that. He owns a software company, and he told me the reason he comes in. Remember that movie with Bradley Cooper called Limitless?
Limitless, yeah.
He says that's what it does to him. He says his creative ideas. That's when he gets his best ideas, and he says it helps his libido as well. So everybody has a
positive side effect.
Yes, very good positive side effect, and he thousand's hard to get through. And as you also know, a shot's quick, but an infusion, once you hit 500, 750. That can take 2-3 hours to get through because of the side effects if we go too fast. But we're right there, as you know. You have a medic training, so you got a lot of familiarity with all this stuff, and you can slow the drip yourself. And we try to show people that, but some people don't feel comfortable moving the little lever. But once they get that sweet spot, I call it the sweet spot. That sweet spot is between, okay, this is going to make me sick, versus, oh, I'm right at the cusp of feeling just at my best. That's the spot that we try. For the most part, a 500 milligram, most people can get through that in about an hour and a half, hour and 45 minutes. We got super studs like you that get through it in 30 minutes.
Every once in a while, for sure.
And it will last for weeks?
So it depends on your dose. It
Yeah.
depends on your body fat, your your tolerance. There's a lot of factors. There's something called the Fountain of Youth protocol that's very popular out there right now, and that seems to be where most of the researchers are going with, and that is a loading. It's a loading dose over a week. So you get 500 milligrams every other day for 3 days total, right? So 1,500 milligrams total. And that has been shown to replace anybody's NAD levels completely. And once you have that, it's good for about 1 to 3 months. What a lot of people will do is they will come in and they will supplement with a shot, like an injection.
Yeah.
In between when they feel like it's coming down a little bit, and everybody will know their own symptoms and signs when it's time to come back in, and just a 100 milligram, 200 milligram shot, and they're good as gold. So everybody has a little bit different way that they like to do it. I've had, the oldest I've given it to is a 75-year-old woman, and she was able to get 500 milligrams down, no problem. And then I had an 18-year-old male that barely could get through it in 4 hours. So you can't ever really predict.
Yeah, each person's different.
Each person is different.
Yeah.
So, but it's wonderful, and as people are starting to hear about it, it's still relatively new, so to speak. Joe Rogan rants or raves.
Well, that's when I first heard about it, and he's been talking about it. He was talking about it years ago.
Yes, and so Hollywood, they always get the stuff first before anybody else does, and now that it's starting to really reach mainstream masses, and it's becoming, hey, to the public, there's something to it. When people come to my IV bar, I tell them, if you've never tried it, I think we did this maybe with you too, try a shot first and see how you feel, because it's a lower investment, because it's not overly expensive, but it's not cheap, right? And so I don't want people to, and one thing you've learned about me, as an ER doc, I'm not a big salesperson, okay? I believe that something should speak for itself. So in other words, you try it. I'm not going to push something on you. I want you to go with the most affordable route. Then if you like it, then we'll talk about going up in dose, because obviously the higher the dose,
the more expensive it is. Yeah.
So, but the fact is, 99% of people who try it once, they say, hey, I want to come back and do it again. I call them NADICs. Get it? NADICs? So... You're not an addict, though. You're
not yet.
A maintainer.
Yeah. No, I mean, and that's the thing. It's like the price point. Obviously, it's not cheap.
Right.
But at the same time, I'm like, if I'm going to spend money on myself, and I'm not going to spend it on, material things. I'm like, I want to invest in my own health.
Right.
And I'm like, and if that's, making me a better person, better human being, physically and mentally, then it's money well spent to me.
Well, and the fact that you are digging it, and I'm sure with your background and your level of fitness, that should say a lot to people. This is somebody I'm sure you scrutinize and you look for. There's duds out there and there's things that work.
Yeah,
and it's an testament to people should see this works. I mean, it does. You wouldn't be coming back if it didn't. And
I had because I had a neighbor he's a doctor, and he was like, dude, I think I heard that snake oil, this and that, and he's a smart guy. And so I was talking to him, but I was like, dude, I physically feel a difference.
Right.
Like, it's not placebo.
Right.
And I've done that multiple times now. So I'm like, if it was placebo, maybe the first time I took it or second.
Right.
Yeah. But I've been multiple times, and each time I feel the same effects, and they're all positive. It's awesome.
Absolutely. One thing about me also, I'm very slow on what I add to the IV bar. You can go to IV bars and they will have everything on there, right? They'll and because they want to make a buck. My IV bar is limited. I mean, I have IV fluids, IV vitamins, oxygen bar, NAD. And of course the weight loss stuff, which that's not placebo. The GLPs, the semaglutide, tirzepatide's no longer around because that got pulled recently by Eli Lilly. But
because it works.
Because it works.
Yeah.
And that's you lead me to a concern. Eventually I think the DEA will catch on that NAD works, and when something works that quick,
Yeah.
they tend to want to get their paws on it.
Yeah, they'll put it on a same thing I did with a BPC 157 and all the peptides.
Yes.
It's what do they? You can't get it made it illegal
Right.
to get because right now they're busy trying to replicate it in a pharmaceutical form.
Exactly.
Yeah.
That's exactly right. And that's another thing. A lot of people are coming in now asking, do I have BPC 157? Do I have some oral? And do I have, and I've heard enough now from people, okay, hey, there's something to this. And so now I'm actually looking into adding that too.
Mm-hmm.
I have testosterone as well. I don't know if you're aware of that.
I think I saw that last time.
Yes,
came in.
and I finally added that on. But with me, everything that I add on is I do some careful research because I want to do it right. We all know testosterone works, but there are places out there that have people who are prescribing it who shouldn't be prescribing it.
Well, yes, testosterone works.
Yes.
But only if it's done in the right way.
Yeah.
And if it's dosed out the right way, which I know plenty of people that go to these places, they're popping up all over the place, the wellness
Yes.
centers that you can get all these things. And I've actually talked to people around here that did it, and I'm like, well, how much are you taking? And they're like, 2 cc's a week. And I'm like, dude, that's a lot.
It is.
And they're like, well, that's what the guy's giving me. And I'm like, you are going to crash your system out. Like,
Oh, they are. They are.
That's not a good dose. You have to have somebody that knows. First, you have to get your blood work done,
Mm-hmm.
and
then-
you have to know how your body responds to all these things.
Yes.
And then you can get dosed out. And usually, it's just a very depending on where your levels are at, but I do a very low dose to
Right.
keep my levels at like 850, 900. I
Right.
don't need to be up in 1200, 1300.
Right.
And I get people like, well, that's what I used to be at when I was in high school or 20s. And I'm like, well, you're not in your 20s
Right.
anymore. And yes, you don't have to have low T. You can get it to a certain level, but if you go above and beyond and are like getting up to 15, 1600 at your age, that's
Yeah.
going to have negative effects.
Oh, it has potential to be, it can cause prostate hypertrophy, and there has been shown to be some link to prostate cancer, especially if you have a high risk for it. Let's say your dad had it. Those are things that you got to be worried. These places out there that are just prescribing it. I mean, it's not even physicians prescribing it. I mean, there's places where there's a nurse taking a standing order, and I'm finding out, when you talk about labs, there's about 11 labs that should be ordered. There's places here in town that are ordering just the total testosterone level and a PSA. That's it. You have to have a luteinizing hormone, FSH, estradiol. All those need to be ordered because it's the after effects. Okay, like estradiol.
You're saying it's because it's a part of the whole system.
Absolutely.
You can't look at one.
You can't, and you potentially can cause somebody to really to get sick or get cancer. Estradiol, if your levels are really high, that can convert your testosterone that I'm giving you, right? This we call it exogenous, into estrogen.
Estrogen, yeah.
And I see where I've looked at their stuff. They'll come to me and say, "What do you think?" I'm on testosterone. I'm like, "Where did you get this from?" Because you need to be on. There's another medication that you have to be on to prevent that from happening,
like Clomid or an estrogen blocker.
Exactly.
Of some sort.
And so there's a lot of places out there to make a buck at the expense of your health.
Yeah.
Not me. I'm by the book. I know I dress fun, but that's part of the brand. That is to let people. I want people to have fun when they come to my place. I as an ER doc, I'm a little bit different than I am at the IV bar. But at the IV bar, you're coming in there. I want you to relax. There's a vibe. And I'm part of it.
No, I like it. I like the vibe in there for sure.
Well, we love you.
Just relax.
I remember when you came in, you were so quiet, very quiet. And all I remember is, okay, that dude looks pretty badass. I'm not going to bother him. And then as you came in and you got to know me, we started talking more. And here we are now. So that's one thing about doing what I do now. In the ER, I didn't get to really talk to people. It's like you get 3 seconds with me and I'm off to the next. Here, I really get to know you. And as you keep coming back and more, we get to know about each other a lot more. And then your comfort level, of course, increases, you feel safe coming to me. You know, I can learn a little bit more about what your goals are and who you are as a person. So it works both ways.
Yeah, it's a cool environment you got in there.
Thank
for
you.
Sure. So let's go back. Like, obviously, you're prior military as well.
Yeah,
right?
retired. Yeah.
Yep, Air Force.
Yes. Sorry.
No, not at all. You have brains.
Well, you got the brawn. So,
Yeah, that's why.
But you're all, I mean,
If you're gonna be dumb, you better be tough.
No, I've always I went into the Air Force. Golly, that was forever. So my story is kind of funny. I met a girl. I was 17 when I graduated from high school. I grew up in Texas, and one day I made a trip to Las Vegas after I graduated, and I met some girl, and she was Mormon. Nothing against Mormons. I think they're all great. I actually went to University. I went to University of Utah. Believe it or not. The reason I moved up to Utah because I didn't know what to do with my life. This relationship didn't work out after about 6 months. I didn't want to go back to San Angelo, which is a podunk little city. We're in Midland, Odessa.
No.
Yeah, that's where I'm from.
Oh, from Midland?
Midland,
so you know
Odessa.
San Angelo.
Oh, yeah.
It's that little triangle of oil. And I was embarrassed. I didn't want to go back. And so I said, what am I going to do with my life? And I never had any aspirations of being a doc. And then finally I just said, you know what? I'm going to make some of myself. And I enrolled. I got accepted to University of Utah, and which was culture shock because majority are Mormons there, and I was not. And so that felt weird. I felt kind of isolated, but I was determined I'm going to do something with myself. So I applied myself, and eventually my grades were so good, ROTC came and talked to me, the Air Force ROTC people, and they said, hey, we noticed your GPA is almost a 4.0. What do you want to do with your life? And I said, you know, I'd like to be a doctor. And everybody laughed at that because I wasn't the best student in high school. I didn't apply myself. I knew I was smart, but I just didn't apply myself. And they said, well, I'll tell you what, if you get into medical school, we will pay for it. And if you get into residency, we'll pay for that too, you know. And I was like, oh. But they said, but here's the stipulation. You have to have above a 3.5 GPA. If it ever drops, you lose your scholarship. So I signed on with ROTC in my undergrad. I maintained that 3.5. And then when medical school, when it came to apply, the part of the stipulation was if you didn't get into medical school, you're going to have to come on as a personnel officer. I did not want to do that. So I got into medical school, and it was the best thing I could have ever done. No debt, and when you graduate from medical school, then you are now captain, and then you go do residency. Well, I did my residency in the Air Force combined with the Army. There's a place in San Antonio, you probably know Fort Sam Houston and Wilford Hall.
Yeah.
Okay. So they have it's a level 1 trauma unit. Both of them were. Now it's combined to one. It's just Fort Sam Houston is the trauma center. Wilford Hall kind of got shut down. But when I was in my residency, I was with half of the class of the Army. Those guys I had Delta, Green Beret, and a couple Rangers in there. And that's when I said, oh man, those guys aren't dumb. They're smart. You know, the special ops guys are smart. You know, that stigma.
Yeah, it does. It takes a level of intelligence.
Absolutely. Yeah. And, you know, I learned a lot from those guys too. And, you know, when the stress got there, and sometimes, you know, stress does get there, you know, they lift you up. And because if they can make it through that, you know, they're going to make it through anything. So just sometimes you ever feel like it's called imposter syndrome. And I felt like I really didn't deserve to be there. And it took me a while to get past that, where I finally said, you do deserve to be here. You worked hard. And once I got past that, then I really began to enjoy residency. Residency's 3 years for emergency medicine. And next thing I know, you know, I was graduated, and I did do a little stint as a flight doc. I don't know if you're familiar with the flight surgeons, but after a couple of years, so I actually flew in the F-16 with the Air Force pilots at the weapons school. I was their doctor, and then I finally got my first ER assignment out at Keesler Air Force Base, which is in Biloxi, Mississippi.
How was that?
It was, let's put it this way. First I was, okay, where is that? Like you just said, or how was that?
No, how was that? Yeah, I know where it is.
Okay.
That's why I'm asking.
Yes, it turned out to not be that bad. I was the medical director, and which was a big deal, and I started to hone my leadership skills and started getting very comfortable with that. Again, there was always a little bit of self-doubt. Are you really truly a leadership material? And then as time progressed, I realized, hey man, you deserve to be here. Then I got an opportunity, something came along called CCAT, which is Critical Care Air Transport. And maybe you've seen these guys. Those are the docs that come with a respiratory therapist and a ER or ICU trained nurse. You go to University of Cincinnati to audition. It's a high washout rate. It's very stressful because what it is you are an ICU in the sky. And what they'll do is they'll put you on a simulated C-17 or C-130, lights out with the red lights on, and they will take out your nurse or they'll take out your respiratory therapist, and now there's the doc having to manage 3 intubated patients on an aircraft. And I made it through that. And that I really said, okay, this is where I want to be. So I got deployed twice as a CCAT doc, the critical care transport, once to Iraq and once to Afghanistan. And that was probably the best part of my career. It was the most rewarding part of my career because I took care of guys that were, you don't take the walkie-talkies. You're taking the guys that are intubated, burned, have an ICP monitor. And I mean, I remember there was a couple of times when we landed, it's because you pick them up.
Take them to Germany.
Take them to Germany. And when you're in the air on an 8-hour aircraft ride, there's no diversion. You're it. If something goes wrong with that patient, you're it. So you learn to think on your feet a lot, but they put you through some really good training to be able to do that. And it's why there's a high washout rate because
So I'm sure it's a lot of stress inoculation, like everything catastrophic is going wrong, and let's see how you handle it.
Absolutely, they throw it all in there, and so that was the most rewarding part. So after I did those, when I got back to Keesler, I was kind of a little bit burnt out. I'd done a year of deployment. I know that's nothing to you guys, but to me, I had a family.
A year?
Yes.
No, that's...
Well, I did 6 months. I had 3 months break, and then I got sent back.
Okay, yeah.
And I was tired, and so I said, listen, I want to move to, my mom had just died. I wanted to go back to Las Vegas, Nevada, to Nellis. I was promised an assignment, and then they said, we're going to give it to you. But then all of a sudden, I got another notice to deploy as CCAT again. And I said, I'm done. And so I got out after 14 years. But then my wife, who's smarter than me, said, why don't you finish the reserves at least? So I accepted I was the regional CCAT director out at March Air Reserve Base in California. And that was the longest 6 years of my life because I hated it. The reserves are a different... you ever heard of LARPers? You know those LARPers?
Oh, yeah.
Okay, that's what reserves are. Those are people who, during the other 28 days of the month, they have a mundane life. They probably work at 7-Eleven. But then when they get there, they all of a sudden...
well, the weekend warriors.
The weekend warriors,
Yeah.
and it goes to their head. And it was very hard dealing with that. But I finished it out. And I
You
did
did 6 years, so you did 14 and then 6 years in the reserve so that you could hit the 20 to
Yeah.
get your benefit.
Exactly.
Okay, got
And
it.
I was working as a full-time ER doctor in Las Vegas, Nevada, at Sunrise Hospital, and I did that for almost full 6 years while I was in the reserves. And so it was a lot of driving. I was tired. I was the night shift guy, and that wears on you after a while. And Vegas it's its own entity. Most ERs in the United States, when it gets to be 2 or 3 in the morning, it slows down. In Vegas, it speeds up. It's unreal. And
That's what I was going to add. You must have got a lot of good work, at least, like a lot of practice while you were out there.
Oh my gosh! You get everything that you can think of. You get. It was the most violent. It was right off the strip near Maryland Parkway, which is not a very nice place. So, but it was good. I used to have a beautiful set of hair. This is why I wear this now. I lost it all. No, this is for branding, but I do have no hair. But after that, I said, to my wife, I did have a tragedy in my family. I lost my son unexpectedly.
Oh,
I'm sorry, man.
That's all right. But it was hard. I found him. He didn't die from suicide. He died from anaphylaxis of shrimp. And I found him in his apartment. And so that changed me.
How old was he?
He was 21.
Oh, man.
Yeah, he was my only son. And, it devastated the whole family. So my wife and I decided, let's get out of this. Vegas brought a lot of PTSD to me. It reminded me of my son.
Yeah.
So we moved to Albuquerque, New Mexico, and I was there for 2.5 years. I really was actually enjoying it, and then COVID hit. They shut that complete state down, and I said, I'm not going to live my life like this. Florida was open, and I like the way Florida thinks. So literally, I got a job within a week. They flew my entire family down. I got accepted at Fort Walton, and I signed a 2-year contract. But during that time, now I'm 56 years old, and I've been an ER doc for so long, I started feeling it a little bit. And that's when I said, you know what, maybe it's time to try something a little bit different where I can talk to people, a little less stressful, but help people keep their best before they become their worst. And, I kind of use that as a little slogan.
Like preventative medicine.
Yes. I wanted to do something different. So my wife was completely supportive. I decided to open IV bar because I felt like I saw a lot of IV bars being mismanaged and a Wild West show being out there. If you notice, if you go to most IV bars, there's not a physician there.
No.
And that bothers me.
Well, most of the time, isn't it? Especially probably around Destin area, it's people coming in with a hangover, wanting to get IVs.
Yes, that's a big part. That's a huge seller.
Okay.
And it's seasonal, right?
Yeah.
It's more for certain holidays and
Spring break right now. Yeah.
Right.
Yeah.
And I'm not complaining. I mean,
Sure.
But and that works. A lot of doctors will tell you, it's placebo. If they can drink, well, yes and no. To get a liter of fluid in your vein in 30 minutes, you're going to feel better quick.
Yes.
To sell somebody who's hungover and tell them they got to drink water, that's harder than it's to be said. They don't feel good. Nobody wants to drink water. So, is it cheating? Maybe that's the way that a lot of docs think. Or am I contributing to somebody, they should feel miserable because they deserve what they get? I don't believe that,
No, I mean, if you have the funds and you're like, hey, I want to get rid of this hangover, I want a banana boat, bag in me, then great, man. Because you are going to feel better afterwards. It's going to replenish you from everything that you've done to yourself from the night before. Hey, go ahead.
Absolutely, they do. They feel better immediately. I mean, halfway through their bag, they're like, I'm ready to go drinking again. They say, all right, I did my job.
And it's not cheating; it's thinking ahead. It's I got yelled at when I was in the teams one time because I was a medic, and we had to go train out at Nyland in California, and it's 120 degrees there all the time, and it's you're running around full body armor for 3 weeks. And it's draining, and you're not getting any sleep. So I would, before every training op, you do there's a 15-mile hike in to go hit this target in 120 degree heat. I would go in and pump myself full of 2 bags of LR, and I would give it to whatever guys wanted it as a precursor to what we were about to do.
Right.
And then, some guy came in and was like, why are you doing that? And I'm like, well, why wouldn't I?
Right.
And he's like, that's, cheating, and, they should be hydrating on their own. I'm like, okay, but if they get 2 bags of LR right now, that's less water they have to carry on this op, so it makes them more effective.
Absolutely.
And I'm like, so it's not cheating, it's thinking ahead.
It is thinking ahead. And when you drink water, it's going through the digestive tract, right? So you're not going to get all of that. A lot of it's going to continue through your digestive tract and come out the bottom. And, with getting all of that fluid immediately, there's distribution of where that fluid's going to go, but it's going to go where it needs to go quickly. So, people feel better. Their headaches go away. To say somebody's cheating when you're making them feel better seems to be a violation of the Hippocratic Oath. First do no harm, right? If I'm making you feel better, then
it's like saying taking Motrin is cheating then. Because
exactly.
You worked out yesterday and made yourself sore, so you should just pay for it. It's like, no, or you can take some Motrin and get the swelling down. And
absolutely. That even happens with the weight loss stuff. I have so many women that will come in and say, please don't tell anybody. First of all, we're just like hip hop. We're not going to tell anybody about their history. I'm not telling your husband. I'm not telling anybody. That's your privacy. But women will come in and tell me they don't want anybody to know that they're on the GLPs, the semaglutide.
Is that like a Ozempic type deal?
Yes. Okay. It's all same category. And I say, why? And they go, well, you don't understand how many haters there are. I will get shamed. I will get ridiculed. I'll get a scarlet letter. And I just don't want to go through that, which kind of hurts because referrals are great when people say, hey, so I say, so cheating, huh? Okay, well, have you ever shamed anybody who's gotten a gastric bypass? They're like, no. And I go, that's the ultimate cheater. But why is that okay? But you taking a medication to lose weight and you're going to get shamed? That makes no sense to me. GLPs have done more for the population than any other drug. In fact, the American Journal of Gastroenterology and Bariatric Surgeons, the bypass surgeon, they came out and said the obesity pandemic, for the very first time in 40 years, it was always going the wrong way.
Yeah.
Dropped.
Yeah.
And they attribute it to those medications.
Okay, so let me ask you, because this is a topic that comes up and we talk about Ozempic, right? Because I think a lot of the population is on it.
Right.
Obviously, and you can correct me if I'm wrong because I might have a misunderstanding, Ozempic came out for diabetic patients.
Correct.
Right? That was the first initial, like, hey, this is for, because obviously diabetes.
Type 2.
Most of them are overweight.
Yes.
And actually, I think my dad is on a form of it right now, but he's got aphasia and going into Alzheimer's, which is also diabetic. Like they've done studies now where it's like if you're diabetic, you're going to get Alzheimer's and aphasia. That I understand. I'm like, cool, yes. And then I do understand for diabetic patients, and I guess, for some people who are massively obese and they just can't, like, get up to actually do things to lose weight, this is a good kickstart to get them to do it. What I've seen also, though, is you have these housewives or whatever who are abusing it in a form, like, because they're like, oh, I just want to be skinny and I don't want to put in the work to actually get there. And that's where I don't have like an issue, but I have this, like, I'm like, okay, dude, at what point are you just going to take Ozempic the rest of your life?
Right.
Or are you going to do something yourself about this? Like, you can take Ozempic as a Kickstarter, I guess, to be like, okay, I'm starting to lose weight, but are you going to implement the discipline and the routines needed to actually maintain losing that weight and maintain a healthy lifestyle so you don't have to take Ozempic the rest of your life?
That's a great question, and that's also part of that where a lot of women get this shaming from, right? Because these women will say, oh, you're cheating, right? So they keep it a secret. And, so there are criteria that need to be met for me to even, give it to you. Because I agree with you. I've made it clear. I'm not going to make you anorexic because there are women that will try to make it the new bulimic or anorexic drug of this century. Believe me. And they have to have a certain BMI, okay? And that BMI, so to get the brand name stuff, the BMI has to be greater than 30. That's a heavy woman.
Yeah.
Or man.
Or man, yeah.
And, or 27, greater than 27, but you have to have 2 cardiac risk factors. In other words, you have hypertension, high blood pressure, or high cholesterol, or you have coronary artery disease that they've diagnosed on a angiogram, right? You have to have that. Well, those restrictions got dropped down to you have to have a BMI greater than 25 because you still are considered in the obese, but mildly obese, and of course when it became on the generic side, a lot of places extrapolated that to misusing it. Okay? Yeah. So that's where I will say this. There are people out there that need to know the rules before they break the rules. And by that I mean physicians versus non-physicians that are doing this. I have scruples, I have morals, and I also follow evidence-based medicine. I do get, like, I have so many people, let's say they come in, they have a 26, 27 BMI. They won't qualify for the brand name stuff, right? Because by the insurance criteria, and that's what it's about, because these drugs are outrageously expensive. But I will have a talk with them, and I let them know this is a catalyst to help you get to where you need to be. I don't want you on this more than 3 or 4 months, okay? This is to get you started, to get you, hey, I can do this. And I tell them, the minute we start this drug, you need to just write a diary. Okay, everybody has a smartphone. I want you to write what you ate. You don't have to calorie count. I make this as easy as possible. Write what you ate and when you ate it. That's it. And I also tell them, don't eat when you're not hungry and stop eating when you're full. I can't tell you how many people don't understand that concept. They don't. I grew up in a family where if I didn't eat my whole plate, I got a little beaten. You know, so that carries over into adulthood when you go out with friends and you order a meal, and people feel like if they don't eat the whole thing, they're
wasting food.
Yes, and
starving children in Africa.
It looks rude. So I have to really get into their head and tell them, I know you don't want your friends to know about this, but they either need to know about it or you just need to not go out and eat with them until you get your weight down. And then I tell them to get off this drug, because that's the number 2 question. How do I get off of it? Is if you keep this diary, okay, and you look at it, you will see the progression of what you're eating starts to go down. Well, once you hit your weight goal, now you know you can do it. It's a psychological thing. A lot of people have a hard time dieting because they don't believe that even no matter how little they eat, that they could ever achieve that goal that they want to hit, right? And once they hit it, I say, look, you hit it. And all you did was just not eat as much. It's nothing spectacular. This drug doesn't directly make you lose weight. It's making you not have an appetite. So you eat less. And now that it's time to get off the drug, look at your diary and just repeat what you did the last week. And if you can do that, you can maintain. Well, no matter how many times I hone that into many, many people, I got maybe about 20% that will actually listen to what I say.
Yeah.
So, and it is, people will look at it as a crutch. They do. But I have to say, I have to weigh it. I would rather than be addicted to this drug versus addicted to something else. It's, when you look at things to be addicted to, so what they do get addicted to is they get it to looking great. But I also tell them this drug has been used in the form of weight loss not that long. It's been a couple of years. We don't know the long-term effects.
So, I've actually looked, I've listened to podcasts and looked into like the long-term effects, which are doing studies. And it's if you are on it for a prolonged period of time, which is, let's say, year and a half, your body will start eating its muscle. It goes into muscle loss because you're not feeding it what it needs. Right.
And there are certain BMIs. I got somebody that comes in with a 33. I tell them, don't worry about that. And I say,
you got a lot to burn.
Yeah. And I tell them, you could probably go, well, it's kind of funny because a lot of people will be like, I wasn't hungry for 12 hours, so I decided I better eat. And that defeats the purpose, especially the higher BMI. I tell them, look, you have enough food on your body that you can go probably a couple of days without eating. Really, you can. Months, really, before you even begins to go after your lean mass. So I say your body's going to tell you when it's time to eat. Trust me, it does. Yeah. And when they follow that advice, the weight comes off great. There's people who want to lose all the weight tomorrow, right? And they'll come in and they're disappointed that they're only losing 2.5 pounds a week. And I'm like, you don't understand. If you lose faster than that, you're going to start to look cachectic, and people are going to start thinking you have some sort of malignancy. Okay, you've heard of Ozempic face? Remember that?
O-face, yeah.
Yeah, so that's because those are people losing weight faster than they should. Again, that's usually under the guidance of somebody who doesn't know what they're doing, or they're over too much of the
overprescribing.
Yes. So I'm a stickler. I warn them if I see them starting to approach you want to be in the green phase, that BMI in the green phase. Once we hit that, I tell them it's time to taper down. You got to get off this, and they do respect that. They do.
But there's also the other side of it too. I mean, if you're obesity, all the stuff that comes with your health being obese, and so
Yes.
you're trading that off. But it's almost like Ozempic type drugs, or the TRT for men,
Right.
in a sense. For I guess
Right.
there's probably men that take Ozempics too, but
Yeah, I have several that are on the testosterone and the Ozempic.
but you gotta just like when you're talking about, okay, I just take a little bit, but I'm working out, I'm on my diet, I'm
Right.
doing all the other things, and I just supplement a little bit.
Yes, I think that's a rule for everything. It's like everything in moderation.
Correct.
Right. But the problem is, America is the land of excess. It's
Yes.
like we have everything, so everybody wants everything all the time. They want immediate effects. They want and same thing like you said. These people that are taking Ozempic, like, oh, I only lost 2 pounds. Like, why haven't I lost 20 pounds in a week? And it's like, well, that's not how this works.
Yes.
It's like like you said, if you're losing that much weight in a week, you're you're dying. Like
Right.
you're unhealthy.
Oh, without a doubt. And you want to do this healthy. So one of the things that made me very popular, most places, if you go to them, they're going to hand you 4 syringes and say, you're on your own, okay? And good luck trying to see the doctor again. They have you inject yourself, and if that dosage they're giving you, it may not be enough, or it may be too much. Either way, they don't care. I make everybody follow it with me once a week. They love that.
Good.
Okay? The online crap, Henry's Meds, all those places, try to get a hold of a doctor after they hand you that stuff. Good luck. It doesn't happen. They don't want to talk to you. They want to give you meds. You get what you get until the next month. With me, there's no charge for. They follow up with me. There's no charge. Everything. My prices are. My stuff is the best stuff there is that's not brand name, because I pride myself. My business model is, I'm going to give you the best product that there is. I'm going to lower the price. You're going to get to see a physician. I'm undercutting what a lot of my competition is, and you're going to get those results. People tell me they like the accountability. They like the safety of seeing the doc, because if they have an issue, I address it right there with them. Mm-hmm. I make the visits fast, and if they're losing way too much, we talk about it, and I lower it down. You don't have that when you're getting something sent to you online.
Yeah.
And and also they have my card, my business number, my text. So I'm very, very in tune to helping them no matter what time of the day they want. And that's why we became number one so fast. So it's old school. I get to talk to a doctor. It sounds silly. Back in the day, that wasn't even a question. Right?
Yeah.
So
we've come a long way from that to we'll just deliver the meds to your house.
Yes.
And then you take, which is when I got out of the military, that's exactly what the VA tried to do to me. They
Yes.
were like, hey, well, first off, they immediately wanted to put me on all sorts of pharmaceuticals.
Yes.
Because I was like, hey, I'm having these issues from my career, which is, they're not unnormal. Like everybody that is in my profession has these issues, and they're not something out of whack. But
Yep.
you can solve those issues naturally, but it just takes time. But what they want to do is like, no, let's put you on all these medications. And then I denied it. I was like, I don't want it. But then they would call me and be like, we'll just deliver them to your house, and then you can take them as needed. And I'm like, that is not how the medical, professionals work. It's like, you need to have a professional be like, dude, these are like, this is what you should take daily. This is the amount you should take daily. You should not go over this. But if you just give pills to people, deliver them to your house and leave it up to their own discretion, then you are naturally going to get people that abuse it, that become dependent on it, and then that just leads down a road to, unfortunately, some putting a gun in their mouth.
That's absolutely just horrible. It's set it and forget it. Ron Popeil, remember that guy? That's what they do. I call it the set it and forget it. Here you go. You're out of our hair for 3 to 6 months. We don't have to see you again. Medicine has really lost its touch.
Its personal touch.
It has, yes. And so when people I mean, if you go to the doctor, it's highly unlikely you're going to see a doctor nowadays. I mean, you're going to see somebody who's not a doctor. You're going to see somebody who is a lower level. And I don't have a problem with that if it's utilized in the right way, right? If it's for follow-up, that's fine. But if you have an issue or something you want to bring up, you need to speak to the doctor. Am I over-speaking? I hope not.
No, not at all.
Oh, okay.
Not at all. No, sorry. I was looking at some notes.
So, I'm bringing back old school. And the reason, again, like I make my place, you've been there, it almost looks like a Vegas nightclub at times. I wanted to change the old, okay, looks like a doctor's, it looks medicinal, to you feel really comfortable. And your experience just being in that place itself is uplifting to your spirits, right? You're relaxed.
Yeah, it's like a Zen vibe.
Yes, yeah. And you get to see me when you want to, and we can address those issues. And I want this also. It's not a doctor outfit. You're used to the white coat and all that. I think that's kind of pompous. I want you to feel. I want your guard to be let down. I don't want you to feel that. A lot of people get what they call white coat syndrome, which is when a doc walks in with a white coat, immediately their blood pressure goes up. Maybe there's some anxiety. Because it's normal. That's probably something that started when we were children. We remember seeing the doctor come in and immediately kids scream, right? I haven't even done anything yet. When I see children like this, they look at me and they're confused. Who is this guy? And then, when I start talking and make little jokes, their guards let down. Now I've established a much better rapport between the client or the child, even the parents. They really appreciate it. But when they hear me start talking, they say, this guy, he knows what he's talking about. Which leads to one more thing. As an ER doc for 25 years, I lost the touch of how to communicate with people. I even found myself where I became, the number one complaint for ER docs is that doctor was an asshole, right? He was a jerk.
We had no bedside manner.
No bedside manner. And that's not because we didn't start that way.
No, you're desensitized.
We're desensitized, and we're also there's a lot of corporate medicine takeover. It's see more patients, spend less time. That is the truth. Those are metrics that have been created because it's all about the mighty dollar, right? The more we see, the more money they make. So that's put a lot of stress on docs to hurry up and get you through, okay?
Yeah.
And I don't like that. That was another thing that made me a little bit, disgruntled about how medicines ran. By me opening this IV bar, and the reason I did it 2.5, almost 3 years ago, I had just turned 54, and I was feeling it. I was feeling a little bit of a burnout. I felt like this is not what medicine should be. And my wife, God bless her, said, do you want to try something a little bit different? So I stayed on as a as-needed doctor with Fort Walton while I got this thing going, this IV bar. And I found that it's just as therapeutic for me as it is for you.
Yeah.
Because I'm getting to learn about people. I get to talk to you. I get to actually hear what's bothering you. I'm not going to ask you one question and walk off.
Yeah.
I get to learn about you. That really means a lot to me.
Has that been helpful? Like, I mean, I think of, dude, I can't even imagine losing a son. Like, I mean,
yeah.
Is it been like, hey, now I get to do something where I'm directly helping people every day? Like,
yeah, it fills your cup.
Yes, I have had more people come and thank me in the last 2.5 years for what I'm doing for them here at the IV bar than I ever did as an ER doc, and that's so crazy to think that.
Yeah.
I think I can count on just one finger when somebody came back and said, "Thank you for saving my husband's life." I think literally saving their life.
Yeah.
It's really weird. It's like, wait a minute, I'm not doing anything. And I finally figured it out. I talked to them, and that's probably the biggest thing that actually, there's been studies that people feel like the doctor didn't talk to them. And if you just come in, talk to them, put your hand on their shoulder, you got to be careful. It's the Me Too movement. You do. You have to be really careful, but in a right way. Putting your hand on their hand and tell them, "Hey, it's going to be okay," is more therapeutic to them than you actually prescribing a medicine, and that's what they're getting at the IV bar. They get my odd sense of humor. They get, and it lets their guard down.
Yeah.
Especially when they get to know, hey, he's consistently like this. And I enjoy it. I love seeing people smile. And when they come back, I know I did the right thing.
Yeah.
And our retention rate is so high because I want you walking out that door and I want you going, I can't get this at anywhere else.
Yeah.
This was something unique. So
one of the best things in our company is our customers know how much we care.
Yes.
You know, and if you go to the Ivy Bar, that sounds what you're saying, that
Yes.
people know that you really care for them.
If you look at my reviews, and there's a lot of them. There was another Ivy Bar, I won't say the name, that's been here twice as long as She's been here for about 6 years. And, her reviews, she had like 80, right? And I told everybody that works for me, I want everybody to come in to feel like that they're family. Because I've been on that other end. I've taken my dad and seen how he's treated. And you probably have experienced that when you get treated like just a second-class citizen. It's like you feel like, wait a minute.
Well, you're like, why am I even here?
Right.
Yeah.
And it's very demeaning. You feel like they make you feel like you're taking up their time, or you're a seeker or whatever.
Or you're just another number on their list.
Just another number. So I made it a point. I want everybody in there to feel like family. I make sure everybody gets called by their name. You know how people love to be called by their name. That's important. I read Dale Carnegie's 7 Ways to Win Friends and Influence People. He was a genius. It's true. Ask them, tell me about your day. Tell me who you are. What do you do for a living? That's important. People want to know that their doctor cares about them. So just those little simple things, that immediately opens them up for trusting you.
Yeah.
And as long as you're consistent about it and do that every single time, they will. If you look at my reviews, you'll see a theme. They made me feel so welcome. Oh, I felt like family. And that's how I always want everybody to feel.
That's great.
I really do. Because I've seen my mother get treated like a dirt bag, and I've been treated like a dirt bag. And I don't tell them I'm a doc. I observe, and I'm like, this is the way majority of people get treated, and it's unfortunate. And again, that's not how doctors. I went through med school. We don't start off that way. We're all excited, and we think we're going to change the world. But unfortunately, the system makes us that way.
Well, yeah, and then the bureaucracy that comes with it.
It does.
It weighs on you, and then eventually it's like, ugh.
Yeah.
Yeah, and I think, you can get that with any profession.
Absolutely.
Right? It just naturally happens that way. And, yeah, you have to go out of your way to avoid getting that negative,
Yes.
personality through doing the job over and over again. Like, you really have to sometimes take a step back and be like, dude, why am I acting this way? Why do I feel like, negative today going into a job that I started off loving? And it sounds like that's what you did, moving here and then starting your IV bar.
Yes.
And you created a culture.
Yeah.
Yes.
You got to create a culture that is customer centric.
Absolutely. And my nurses that I have, first of all, I've never had one nurse quit because they love coming they love to work there. They feel good. Have you ever been there? You probably haven't been there yet. Okay.
I'm coming.
Oh, you should. I'll take care of you.
I'm going to do some in NAD.
Yeah, Dave, we'll go do it together, buddy.
Oh, yeah.
Yeah.
Let's all three do it together.
I'll race you. You'll win.
We'll see how you feel.
Exactly. They love it because day one I tell them, treat this person like you would treat your mom, okay? And they love it because you've dealt with Crockett nurses.
I worked in the ER. Yeah.
So you know what I mean. And some of them, oh my gosh. So, but once I show them, hey, you're allowed. I want you. We're not ER nurses here. By the way, that's all I hire is ER or ICU nurses, because they are the best as far as IV placement. They are.
Oh, I can tell. And that's the other thing I judge, because I went to a couple of other IV bars, in the past, and that's the first thing I judge off of is like, are you able to stick my veins? And some of them, it's like 4 times, and I'm like, and it's not like I have veins that are pretty easy to stick, and I'm like, what is going on? And
Yeah.
are you even qualified to be doing it? And I have to coach them through it. I think one time I even stuck myself.
Wow.
I was like, just give it to me. And I put it in. I'm like, there you go.
See, and that'd be embarrassing on the place that you're at that you had to do that. And so no, they're the experts. Yes, I pay them a little bit more because you got to when you get talent.
Good.
You got to pay for quality.
You got to pay for quality, but what does that do? That brings you back as a return customer.
Yeah.
Because you remember that, hey, they did a good job, and consistently overall. And again, that's another thing. You look at my reviews. I mean, there's 560 reviews.
Good for you.
We've only been open a little over 2.5 years.
Good for you.
And
How is it being in the private world now?
I like being I like being the boss.
Yeah.
I do still, like I said, I still work at Fort Walton just to keep my credentials and stuff going, and my skill set, because that's one of those things, you don't use it, you'll lose it.
Yeah.
And it also it's nice because when I work in the ER, I go, okay, I'm so glad I opened up this business, because it's such night and day.
Yeah.
I don't have the same pressure that I used to when I worked in the ER, because it was the only thing I had to rely on for a source of income.
Yeah.
So I don't feel as easily manipulated or intimidated by certain corporate the hires up, because but they also know that I'm a good doctor, and so as long as they know that you're a great job. I've actually become kind of known around here and having a reputation as that a little eccentric doc, and it's well accepted now at Fort Walton, Maine.
Good for you. It's good marketing. Honestly,
absolutely.
And if it's one thing to do marketing and your services are crap,
Right.
but if your services back it up,
Yes.
and your reputation, then that's a separation. It's good for you.
I'm only cocky because I can be. But it's fun. I enjoy doing what we're doing. You can tell. I love it.
Yeah,
And,
every time I go in there, you guys are everybody's in a good mood. Everyone's, like you said, it's very personal. Everyone's like checking on how you're doing.
Yes. Have you ever noticed, what's the first things that comes out of our mouth after you get IV? Can we get you water? Can we get you a blanket? Is there anything else we can do for you? Pillow. I don't want you having to ask for those things. I want those things asked before you ask for it. And that personalized, customized service goes a long way. People tell me all the time, holy crap, I feel like a king or a queen. That's the goal. I want you to feel like that it's your birthday, Yeah, every single time.
Where's it located?
It's on Emerald Coast Parkway.
Okay. 98?
36150 Emerald Coast Parkway, Suite 103. You know where Aqua Tile or Small Cakes, it's a little, you know where that Destin emergency apartment is? The little Destin ED? It's a little standalone. We're across the Highway 98.
Okay.
And there's like a little village area. Healthy Coast Meals, I know you guys know where that's at. Healthy Coast
I know where it's at, yeah.
Okay. Lucky Beach?
So if you're heading down the 98 towards Destin, it'll be on your left side.
Right.
Yeah.
You'll see it. It's in that. What is the name of the lobby there? That's there's a sign for the whole.
It's oh my gosh.
Like before Bay Bridge?
It's like Village or something.
Oh, we're oh my Lord! I just had a brain fart. It is country. Oh Lord. I have to think for a second. It's I can't think of what to do.
We'll think of it.
Yeah. It's something like country something, Bayside, blah, blah, blah.
Yeah.
Oh, Lord, I can't think. But, literally, you know where Arby's is? Mm-hmm. Okay. Right across the street.
Yeah.
Over there where Aqua Tile. And,
Yeah.
But they're not.
I know where it is.
What is it? Bayside Country.
Are you open like 7 days a week?
7 days a week. We're open
Okay.
7 days a week. And we open at 9 a.m. every day except Sundays.
Close
Open
at
at 10.
5, 4.
So we close, we go exactly till 4. But when I say 4, if you walk in at 3:59 and you want to get an IV, we're staying.
Okay.
So it's sort of like the like waiter rules, right? Or restaurant rules. We take you right up to the last minute.
Okay.
And you will never feel like you're being your inconveniences. You're happy. You walk in, you're going to, people apologize. I'm so sorry. I know you're closing. No, we're happy you're here. That's what we're here for. So 7 days a week, there's a need for it every day. I have found that it's a little weird that right after a holiday, like a 3-day weekend, for some reason it's always dead. I don't know. Destin's its own entity, I guess.
Yeah.
Just you would expect it to be really high, but I think maybe that might be when most people are traveling in or back to their
transition time.
Yes.
Yeah. It's
So.
Yeah.
We, I've looked at other things to add. I had thought about doing aesthetics, all that, and then because I can't do Botox.
Yeah.
I just said no. I'm gonna water down what we have. So I'm constantly tightening to make what you're getting even better experience for you.
I like the strategy, the go-to-market strategy of having just a handful of choices that you're really good at. You know, it's almost like, take the Red Bar, for example. They got 5 menu, 5 items, and it's like, here's the thing, 5 items, choose one of them.
Right. If you've been to Cheesecake Factory, right? But their menu is 20 pages long. But the good restaurants, and Gordon Ramsay will tell you this, there should just be 1 page.
Yeah.
Right? And do it well.
Well, it's quality over quantity. Yeah. If you put too much stuff on the menu, it's like, well, you might be good at 5 of these things, and the rest are going to be sort of subpar.
Mediocre.
Yeah.
And I learn, and I encourage people like you, because I learn from people that come in, our clients. They might tell me about something that they heard about, or will I look into it? And I will.
Sure.
And if it's something that turns out to be like NAD, that's how I learned about it. I will investigate it. I'll research it. Because I have a couple rules. As an ER doc, I've never pushed something. I'm not making money in the ER by pushing something on you, right? I'm giving you what you need. So that was probably another reason I'm popular. People come in and they're like, "Hey, I want this and this and this and this," and I tell them, that's a little too much. You're going to urinate this out, and it's never going to be utilized.
You're not going to get the full benefit.
You're not going to get the full benefit. So their $500 bill will go down to $150.
Yeah.
And I can't tell you how many times people.
Because you're not getting kickbacks.
Bingo.
You got an opposite of Washington, D.C. approach.
There you go. Exactly. No kickbacks here. I have no vested interests or outside people trying to get me.
Yeah.
So that transparency, that's huge, number one. Number two, I'm not going to give you something that doesn't work, okay? If I have any doubt that it doesn't work, I'm not putting it on my menu, because of course there's places out there, they want your money, and they're glad to watch you walk out. And the third one is, I don't want to be just something that's going to harm you, okay? So if I don't know enough about it, I'm not going to offer it, okay? And then if it is something that, like testosterone stuff, I follow the American Urologic Association, their rules, because you got to do it right. You have to do it right. No shortcuts. I know there's a place, I'm not going to say their name, they're a chain, and a friend of mine told me they went there, and he said he was just interested in testosterone. They order 3 labs, and that's it. Somebody's going to get hurt. There's no doctor.
Yeah.
For real. And so I always have to, I feel bad. I'll apologize when people come for a consult. I'm like, you got to go get these 9 labs.
Yeah.
And you know what they say? Oh, I want you to do this right, doc. I appreciate this.
Yeah.
They're not as concerned about, I can get it done in 3 labs, because I explained to them, these are things that are important I got to look at, because we don't want to hurt you. So being transparent and, let everybody knows me by now, or the ones that don't, I'm not going to hurt you. I'm not going to put something on my menu. IV, that leads me to one thing. A lot of docs will say, IV fluids or IV vitamins, waste of money. Okay. In some aspect, it could be true. Okay. Depending on who you are. If you're somebody who's taking a bunch of vitamins every day and you're not dehydrated, all right, and you come in, it probably is a waste. But if you're somebody who's working out heavily or on a certain diet, maybe you're on a vegan diet or you're fasting, maybe you've been sick for the last week, you know your diet's going to be, or your hydration, it's not going to be what it was. So in that short interim, it is useful for you. Most people that are sick or on a diet or whatever, they're dehydrated, right? That's just part. So
It's not going to hurt you.
no, and it's not going to hurt you. But there are people that I would not give a liter of fluid to. So that's another thing. If you come in and you have congestive heart failure, or you're a dialysis patient, or you just had heart surgery, or you're on a blood thinner, like Eliquis, right? Those are things that are important that I could cause harm. And if I don't know about those things, I could overflood you with fluid. But you have to know the rules to break the rules. I've heard of IV bars. This is from what my clients tell me, that they just came from one in Nashville, and they asked for magnesium, and they asked for 1 milligram of magnesium, and I said, and they gave that to you, IV, without a monitor. That's dangerous.
So what can that do?
Magnesium is what high dose magnesium is what we give to people who are if they're hypomagnesia, right? Their magnesium's super low, but you can cause heart dysrhythmia. You can cause their smooth muscle to become so relaxed that they lose all their reflexes. So women that are like, let's say they just came out of labor, or they're even preeclamptic. Preeclampsia is when a woman is pregnant, their blood pressure starts going super high. That's dangerous. That's called preeclampsia. So what do? They put women on high-dose mag, anywhere from 1 milligram to 5 milligrams an hour. And they do what they call mag checks. You have to be on a monitor. So there's people, and it's always a non-doctor who's doing this. Yeah. So people are going to die. There was a woman here about 5 years ago. She was a nursing student. She died at the IV bar, because selenium was a very popular thing during COVID.
What is selenium?
Selenium is a certain type of metallic element, and a lot of places what they do is they'll extrapolate from a paper that this is good. All right, I'll give you an example. Vitamin C, high dose. Okay, you're familiar with this, right? Yeah. High dose. All right. High dose, there was a study that came out that high dose vitamin C, like 25 grams or higher, given along with chemotherapy for certain types of cancers, may reduce the size of the tumor. Okay? Well, there's con artists out there that will extrapolate. This is what how the final thing was to them is, high dose vitamin C reduces the risk of cancer. You see what I'm talking about?
Yeah.
Those are two different things. So they take that, and then they start selling it that way. And so I will have people come in asking for super high dose, and I'm like, why? Well, I don't want to get cancer. Okay? Again, I'm a transparent doc. I'll have a talk with them, and I tell them that paper or whatever you're referring to, this does not reduce the risk of cancer. Some people have been upset with me, and they're like, they think I'm a jerk, even no matter how nice you explain it to them.
Truth hurts sometimes.
What's that?
I said the truth hurts sometimes.
It does, no matter how nice you put it. And I'm telling them, this is a lot of money. You're going to pee out 23 grams of this. There's only 2 grams your body's going to accept, because that's all it can take. And I explained the study to them, but regardless of what I tell them, if their mindset, there's mindset. There is one subset of people that I will give it to, and those are pancreatic cancer, stage 4, because those people, they're reaching out. They don't. It's a death sentence. Okay?
Yeah.
I do still have to talk with them. I tell them, there's no studies that have definitively showed that this does help, but in your case, I would do the same thing.
Sure.
I would.
Try anything.
Yeah.
Yes.
Yeah.
And they so appreciate that. But I have a conscience, man. I'm not going to take your money for my benefit at your expense.
Yeah, and I can understand, like, with people with pancreatic cancer,
Yes.
They're dying, right? And even though they may come in looking for vitamins, they're like, hey, I want a high dose of vitamin C. And you tell them, like, listen, this studies, don't show that this is going to prevent it.
Right.
But if this is going to make you feel better overall, yes. Like at that, and that's fine. It's like at this point, it's a last ditch effort. I just want you to be comfortable.
Yes, yes, and I do, because I think what really makes them feel good is when I say I would do the same thing. I would, because I'm being honest with them, and they really. When I first started, I was a stickler. No, I'm not giving it to you. It's a waste of money. Well, that didn't work very well. I could tell that hurt their feelings, right? So now I'm like, this is what they want. They want it. Okay, am I doing any favors by refusing that to them? I don't know, right?
Well, and are you harming them? Are you harming them by giving it to them? No.
Right? So, and so I had to kind of rewire my brain. A doctor doesn't always know best because this is what they need to make them feel better. My biggest part was it's not cheap. High-dose vitamin C is not cheap. And if they're going to go somewhere else and get it, right? They are. They'll find a place. Sure. So by me at least putting down, here's what to expect. I'm hoping that this works for you. I would do the same thing. That means a lot when I tell them that, because I would. What I do tell them is, don't go to the Philippines and start getting crystals and all that fake stuff. Because there are places that prey, and people do prey on on fear.
On the weak.
Yeah. They do.
Yeah.
Especially the dying. There's promises that are made. So, again, my ER training, I care. I truly care. If you were my mom, I would tell you the same thing. You're like a family member. The minute you walk in that door, you're my family member, and I'm going to treat you the way I treat my own family.
It sounds like a great culture you've really developed there, and I mean, it's good for your business. You need to make money.
Yes, of course,
and make as much as you can. But you're really delivering the service with it, and people love it, and you've created an atmosphere of really caring for people.
I really do. I can't tell you time.
So much more than an IV bar in my mind. It's like.
Right, right, and you will. I want you to walk out of there feeling like, hey, this doc feels good about me, and it's not just show. I'm not acting. I do. I truly have a vested interest in who you are, where you came from, why are you here? Because I want you to come back. I do, but I also want you to know. I can't tell how many times I've handed my card out and say, if you have any questions, here's my text. A lot of docs do that. There's not a lot of doctors that'll do that. And I can't tell you, just handing that card with my text number, what that means to people. They're not used to that. It doesn't bother me. I take text all day. That's what I'm here for. We're on this planet for a short time, and for you to know that you got a doctor that does care about you, right there in itself, that's therapeutic. Right?
Yeah,
so,
for sure.
And I'm constantly evolving.
It's almost more than a business, like a ministry, like
it really is. It's
a mission.
People feel better just spiritually when they come there. They feel a catharsis of all the weight and stress that's going on in their lives. That's also why I designed it the way I did. I want you to come in there and just not have to think about things, I learned with Eddie, don't talk to him. He goes into a zone and... I
vibe out, man. You got all the, get that screen there with all the trippy stuff. Like, I'm just like, I'm just going to watch this and chill. Yeah.
So I can read the room. I do. I read the room. And, if you're looking at your phone or you're looking down... I'm not going to bother you.
That's also like what I appreciate as well too. It's like, you guys are very personable, and that's awesome when you come in, and I'm like, cool, and everyone's super nice. But then you guys also like, all right, he's doing his thing. We're not gonna bother him, and like
Absolutely.
Consistently come up and
We respect your privacy. Trust me. We respect what you're going through. Everybody's different. Some people want to talk my head off, and I want to talk some people's heads off. I love doing that. But I can tell. If they want their time alone, and like your hangovers, they don't want to talk.
Yeah.
So it's just absolutely the best thing I could have ever done in my life.
Has there been any big obstacles or challenges in the past 2.5 years while running this business?
Yes. So at the beginning, I got to be honest, I didn't know a whole lot about it. There's a stress that comes with this. I was never a business owner or an entrepreneur. until I decided to open this. So there was a learning curve.
Yeah, yeah.
And which, my wife was so used to the high ER doctor salary that I had, but she was, God bless her, she said, I know you need this. And there was ups and downs. There was times at the very beginning if I didn't know if I was going to make it.
Yeah, it's hard starting doing a startup.
Yeah.
Especially, I mean, as soon as you get that space,
As soon as
rent is due the next month.
Yeah, and you only eat what you kill.
Yeah, bingo. And
You gotta market it,
It was
you gotta-
always, oh my gosh, am I going to make rent? Am I going to be able to pay my employees?
Yeah.
But, by the grace of the higher powers above, we kept always making it. And then the best advice I ever got was, I used to be located in a different area across the street at a place called the Plaza. And I bought it. I bought the suite. And after about 4 months of being there, I learned we were going to die a fast death. It was hard to find. It was in the back of the building. It was on the second floor. It was one of those where you had to walk into the building, go up the stairs, and then go out the back. There was no other way. And so location was awful. Number two, I had this illusion of grandeur that, hey, I'm a doctor. As soon as I open this, the people are going to be banging the door down. And that wasn't so true. So after about 4 months, I knew I was going to die fast death. And I said, but at least I recognized we needed to change, and we needed to change fast. So going back to that Italian guy, and that was at the old place, this gentleman walks in, and he says, he looked like he was wearing a $5,000 suit, and very heavy Italian accent, good-looking guy. He just looked like one of those stereotypical,
Mafia.
Yes. And he said he was here. He has a home on 30A, but he lives in Italy, and he sells business equipment for medical facilities. But he wasn't there for a sales call with me. He just was tired, wanted IV. So I get the IV. So he takes his coat off, and he's wearing, you could tell this shirt was probably $1,000, his suit shirt.
Yeah.
And I make the bag, and most of the IV bags have yellow B complex vitamins, so the bag's yellow. As I'm coming to put the bag up, I hit the little lever, that opens up the tubing, and it starts spilling all over his shirt, the vitamins, like a fire hose, all over. And I see that, and it was one of those moments where, when you're shutting your door and you see your keys inside your car, and you know that they're the oh crap moment. That's what I had, and I stopped it. I pulled the thing. He looks down, sees it, and I said, "Oh my God, sir, I'm so sorry." I said, "Let me get a rag. I'm wiping it." And I come back and I go, "I got good news." He goes, "What's that?" I said, "The vitamins are on you." And he laughed. He thought that was so funny. And I said, "But truthfully, I apologize. There's no charge for the IV, and I want you to send me the bill for your shirt. If it doesn't come out, I will pay for it," knowing that it was going to hurt me if I could tell. So he looks at me and he goes, "I tell you what," he goes, "I appreciate that." He goes, "Here's what I'm going to do. I'll accept your offer." He goes, "But what I'm going to do is I'm going to return that back as a tip, the cost of the IV." And I was like, "What?" And he goes, "Yeah, I'm going to tip you what the cost of the IV was." And I was wondering why. So we finished the IV, and I'm walking him out, and he says to me, "Hey, I want to tell you something." He goes, "You're going to make it big in this." And I said, "Why do you think that?" He goes, "I like what you did." And he goes, "Let's be honest. Anybody with credentials can do an IV." He goes, "But they're not coming here for the IV. They're coming here for you."
For the customer service.
And he says, "Be you." And it resonated with me. And he goes, "You'll understand what I mean. Don't be who you are right now. Be you." So I thought about that, and I'm like, okay. So I threw my do-rag on, and I started dressing up in this. And all of a sudden, and I started acting more myself, more relaxed. I have a little bit of a humor,
Yeah.
And all of a sudden, that resonated with people. I was more, "Hey, how you doing? Where you from?" And I noticed our numbers started going up, and our reviews started going up. And I was like, I'm starting to get what he's saying. Be yourself. Once you realize who you are, people will appreciate that. Don't be somebody else. So that continued, and our numbers just kept getting higher. Our reviews got higher. And then eventually we moved over to the location that you're familiar with now. And I continued that. And the next thing I know, I had celebrities starting to come in. Celebrities tend to like quirky places with a quirky person, but as long as they know it's professional and safe. And same thing. It was very well receptive. You've heard Taylor Hicks, that guy who won American Idol season 2. He's a blues guy, had gray hair, looks like George Clooney, but a little bit heavier.
Okay.
He came in, and he kind of had a little bit of that I'm a star, don't talk to me kind of thing. But the second time he came in, and that's when you know that they like it, he's like, Doc, he came up and grabbed me. And I was like, wow. He's like, he's coming to talk to me. And he said, man, I just want to tell you, man, I love this place. He lives in Nashville. And he goes, I've been talking about this. I would love to see this go even further. And I was like, holy crap. And then Struggle Jennings, who's Waylon Jennings' grandson, he came in. He is a rapper. He was the #1 rapper. He does this outlaw. He talks like this, and he's heavy white guy. But
he's a rapper.
He's a rapper, and think of Kid Rock, but 10 times more redneck. I love you, Struggle. You're awesome. He's a big old dude. Looks like a bodybuilder. And I thought he was an MMA fighter when he came in, but he was on tour with Jelly Roll, and his big tour bus pulls up. But I didn't see it outside, but one of my younger nurses goes, oh, that's Struggle Jennings. And I'm like, I don't know who that is. I walk over and I start talking to him, and he's like, yeah, man, I'm on tour. And I said, you're Waylon Jennings' grandson? And he's like, yeah. Well, that guy loved us so much. He started shouting us out on Facebook because he just liked the whole vibe, the whole environment, the way I treated him. And then Tyler Farr, he's a Grammy-nominated country singer. He's been back twice. So I started to realize these people like what we have to offer. You, for instance, I'm sure you know what you like, and I bet you know what you don't like, right?
Oh, yeah.
And when I realized who you are, I was like, that's an honor to me. That means nothing but the world to me, that I'm being accepted by people of your stature, your status, these people. So I'd continue to do this and find just being myself, and the more I'm relaxed, the more people appreciate it. But the things that I won't ever give up is my integrity. I'm never, ever going to push something on somebody. And if you notice that, have we ever pushed anything on you? If you go to a lot of these other places, they will push. We don't push our memberships. We don't push extra products because I think that's annoying, number one. And again, being an ER doc, I never push stuff. So we do, if you there's boards up there that will show and that change on what we have. You've seen our two.
Yeah.
Right? If you're interested, you'll ask, right? And people have come to appreciate that they like that. I don't push. I feel like when you're pushing something, they don't need it, if that makes sense. I do. And a lot of people, like if you go to, there's a massage place that's a big chain. People have told me, you go there, you can't relax. They're pushing. Memberships, this, that.
Yeah.
People don't like that. You go to the furniture store, what do? They push. My place, you tell me what you want, and then if it seems excessive, I will then intervene and say, that's a little waste. Why don't you go down on this? That's so appreciative. But if I start saying, you want to consider this and this, people will get irritated. So
yeah, I mean, what I like about your place too is I'll ask, I'm like, hey, what's that? And then
Yes.
you guys explain exactly what it does. And
Right.
I'm like, okay, then I'll, if I'm like, oh, I'm good on that. And,
Yeah.
Or if I'm like, hey, what's that? And then you explain, I'm like, I'll try that out.
Yeah, and we do. We get people walk in and say, hey, I don't know what I want, right?
Yeah.
What do you recommend? And I'll ask you, what are your symptoms? What are you doing? And then I'll give it to them. I'll show them the options. But there is never, ever, we're not going to push something on you.
That's great.
So
If people want to know more about all of it, your website?
yeah, so we have a website. We're on Instagram. We're on Facebook.
Okay.
So please hit instant follow, like, all that good stuff.
What's your tag?
It is
We'll put-
Aqua Vitae IV.
Okay.
Aqua Vitae
Yeah.
IV.
Yeah.
We'll put a link down below
Wonderful.
for it.
And our website is www.aquavitae, that's VITAE, so aquavitaiiv.com. And even if you go to our Facebook or Instagram, there's links to that as well.
Okay.
We, if people just want to come by and take a look, we recognize a lot of times this is somebody's first time to ever get an IV.
Yeah.
And so it could be anxiety provoking, or like you said, they might be skeptical. We have people that will come because they don't. Their friend wants to get it, and they're like, "Nah, these things I've heard they're da." And once they come in and get a feel and see how we are, they change their mind. Next thing I know, they want to.
Sounds like your place is one of the best for the first time IV or something. I mean, it seems like super relaxing.
Yeah.
I know. I do. I always make a joke. I say I always feel bad for the next place you go for because we're now the standard, and it's true. When you get an IV there under very relaxing conditions. I do, because when you go to the ER, it's not the same. You got people screaming and yelling and throwing feces at people. It's a whole different environment. My place, it's going to be bougie. You're going to feel like a king. And another thing that I do, if it's rare, but if we have a complete miss, like in other words, I have a rule: we'll try you twice, right? If we can't get that IV after the second time, I will give you an option for a third. Okay, so some people are a little bit more difficult, right? We have a vein finder, which has really reduced the rate of misses.
Yeah.
Because I can find any vein on you, even if it's deep. It reduced that. People love that because a lot of places don't use that. But if I can't get your IV, I will give you your IV free if you come back the next time.
Oh, that's awesome.
Or if you're with your husband or significant other or a friend, they get their IV and you wanted one, and we can't get it, I'm giving the friend the IV free, and then I'm telling them to come back. I am not afraid to watch that money walk out because I know that you're going to likely say, "Wow, who does that?"
Yeah.
And they do. 99% come back and let us try again. And we will typically get it the second time. And it's rare to miss.
I mean, it happens.
It happens.
It's but
It happens.
Yeah.
And we don't, I don't have an ultrasound there like in the ER or, I'm not going to put a line in your foot or an EJ.
interosseous.
Yes. Could you imagine? So we could get it if we had those, but, at the IV bar, it's not an emergency. This is a luxury. This is a convenience, and you shouldn't. We don't want to traumatize you. I do ages, because I'm an ER doc. I'm credentialed to see 0 to age till you die. Right? We have people who will call. I'm the only one in town that will do children, but when they call, I let the parents know: A, you have to be there, of course, and B, your child, if they pull away one time, we're not going for a second. We're not traumatizing your child.
Yeah.
And for the most part, vetting them is really good. I've never had one child pull away. The age I tell them that it is 12 years old. That's about the age where a kid's mature enough to say, "All right, Mom, I won't move."
I'll tough this
And
out.
I've never had one child do that. So it's all about just making sure their parents are aware. The parents are so appreciative. I've had people who are pediatricians will bring their children to our place because they see I'm an ER doc. They're like, "I've never
That's cool.
seen it." So yeah, it's all about safety, efficiency, vibe, pricing. You throw it all together, we have it all.
You really do, man. And I'm glad you came on this podcast. I wanted you to come on and talk about it.
Me too.
I love going to that place.
We love having you.
I
there.
swear by it. 'Cause just from the stuff that I do, because of all the travel, since I've been coming there and doing it in between trips, I feel great on pretty much everything, all my trips, and I don't get sick. So yeah, it's
It's an
firsthand
honor that you always
experience.
come in. It is. I love when you're there. Just not because of the money, but because I know that you wouldn't be coming there.
No,
if
I wouldn't go there if
was
it didn't
worth-
work. Yeah.
Absolutely. And as I've gotten to know Eddie, he talks a little bit more. We're up to 3 words now.
Takes me a while to warm up.
Yeah, it's okay. Yeah. So, but yeah, I really appreciate this. Thank you again for allowing me.
Yeah,
on
brother.
Here. Yeah, I can't tell you how excited I was when you invited me, and it's just a complete honor for me.
No, man, this was a great conversation, and yeah, if you guys are local, definitely go check them out. Or if you are a tourist coming in and you guys are down here to party, go check them out. If you want to recover the next day, for sure.
Thank you.
Yeah.
Eddie. Appreciate it. And
Thanks. Thank you, man.
Yeah. Thank
All
you,
right.
both of you. Thank you, sir.
Yeah, buddy.
Thank
All
you.
right. Out.
Out.